Bismillahirrahmanirrahim. Let's take a start from antibiotics. So before studying antibiotics, you should know about the fundamental concepts of microbiology. You should know about the different form of microorganisms, including bacteria, including virus, including protozoans, including fungi. So you must have a strong command on these microorganisms. So today I am going to explain the fundamental concept of antibiotics. So antibiotics can be classified into different categories. So before classification, antibiotic can be defined as those substances or those chemical substances which is produced by the living organisms that kill or stop the growth of microorganisms. So our main target is microbes, pathogen, to inhibit or to kill the growth of microorganisms. So we are going to inhibit, to stop the growth of microorganisms or to kill them. Now what are the different antibiotics that show strong resistance against these pathogens? Antibiotics can be classified into two categories. One is broad spectrum antibiotic and the second one is narrow spectrum antibiotics. So why it is called narrow spectrum and broad spectrum antibiotic depend on the activity, that how much your antibiotics they are potent, how much your antibiotics they are effective. So broad spectrum antibiotics are those antibiotics which not only inhibit the growth of microorganisms, but it can kill both the gram-positive and gram-negative microbes. They show strong resistance against both. These are also called antimicrobial agents. Why they are called antimicrobial agents? Because they show strong resistance against gram-positive as well as gram-negative bacteria. So why we are going specific toward bacteria? So most of the antimicrobial agents, they have shown strong resistance against microbes, against bacteria. The second one is narrow spectrum antibiotics. So narrow spectrum antibiotics are those antibiotics which can only reduce, stop the growth of microorganisms. So it doesn't kill the growth of microorganisms. So it depends on the condition of the disease. It depends on the condition of the patient, that in which condition which antibiotic will be more suitable to treat that patient. So here bacteriostatic mean are, they are also called narrow spectrum antibiotics. It can only inhibit the growth of microorganisms, not to kill them, via spores. So is the case which I am going to explain in broad spectrum. So it has different spectrum of activity. It has strong activity against gram-positive and gram